And just on this strain of virus, do you agree with the assessment that the infectious strain is spreading faster?
So I guess there's two parameters there. I think it's not really controversial to say that these variants have been shown, or most of these variants have been shown to be more infectious. The way that's often looked at is in closed areas, so like in households, what's the attack rate, what proportion of the people in the household get infected. And for the variants, including B117 and the Kappa variant that we're dealing with at the moment, that has been shown to be higher than for the strain that we were dealing with last year. Sorry, I'll just finish that. So the other thing that we have seen is that people, like the case that we had today where we linked it, there certainly are people that have been strangers to each other that have acquired infection from each other, and we know that they're not, they didn't interact with each other, they weren't at the same cafe, they weren't at the same shop at the same time. And really what that shows is that this is a very infectious virus. Now, it is possible that because of our contact tracing and the careful way that we're taking, travel histories from everyone, that we are picking up some of these cases that way. And so that reflects, contact tracing as well.
What do you think of the critique from some epidemiologists that the language around this strain has been fear-mongering?
Look, I would say that it is more infectious. I spoke to Professor McCaw this morning, and we certainly agree that this Kappa strain and the Alpha strain are both probably about 50% more infectious than the strain that we had last year. The other Indian variant, the Delta strain, or B6172, is probably even more infectious than that, but that's not the one that, thankfully, that we're dealing with.
Do you agree that it's behaving in a different way to what we've seen in previous outbreaks?
It's behaving in a different way in the sense that it is more infectious. So, in careful studies...
Jumping between people any different? The fleeting transmission, is that something that you believe?
It is more infectious in the sense that more people get infected for every case, so I think that's accurate to say that. The other thing I think that maybe some confusion over is we've talked about this serial interval, so this is the time between when the first person gets sick to the time that the next person they give it to gets sick. That actually is shorter when there's good contact tracing, because people aren't transmitting on the 10th day of their illness. We cut off their transmissibility, and therefore that interval looks shorter. So that's, again, a sign of good contact tracing, and also the fact that we can pick up transmissions through relatively fleeting interactions.
He said that this current epidemic has an R0 value of about 1 to 2. It was above 2. He thinks it's now back below 1. Professor Sutton has likened this variant to measles, which has an R0 value of between 12 and 18. Was it reasonable for him to make that comparison?
So R0 is the reproductive number when there's no controls in place at all. And so we think for the wild type virus, for the virus that we had last year, it was probably about 2.5. That figure for the UK variant, the Alpha strain, is probably about 3 3/4, and for the Indian, the Delta strain, which is not the one that we have here, it probably is about in the order of 5. But that's when you don't have anything, any controls over the virus. Even before all of this, despite we didn't have lockdown, people were still behaving in a way that they weren't interacting as much with each other and taking care. And so that probably was suppressing the virus to some extent, but it was still able to grow. So it was they are effective. The effective reproductive number in that situation was around 2.5.
And as 5. Sorry.
Yep. Sorry. And then as we've tightened up, even just before the lockdown, we think that the R effective was probably around 1.1 to 1.3. We think now, with everything that we're doing now, it probably is below 1, and the national modelling experts estimates put it at about 0.69. Obviously, there's a range of uncertainty around that, but that is lower than 1, and that's encouraging to say that if it won't spread widely, but obviously that's with contact tracing, with everything else that we're doing.